Do you know the foods you're eating could be making you sick? Now this is really amazing to me because most people would have no idea. I don't know who, I think it was Hippocrates who originally said one man's meat is another man's
poison.
Poison, thank you. Did you? Yeah, my staff answered that. We planted her. Good.
Good job.
Let's see here.
Good job.
Okay, so hold on a minute while I put this aside and use my finger. Okay, good. Allergies. When we think of allergies, what do we think about? We think of, the coughing, the sneezing, the red eyes and stuff like. Gilbert, it's great to see you. I saw you all good, but it's always good to see you. But the eyes watering and all that, this is really not what we're talking about with food sensitivities. And I'm going to make this distinction because I believe it's very important to understand that food allergies are not food sensitivities. They're two different ball games. A food allergy is something that happens from an immunoglobulin called IgE. Don't get too caught up in that, but it's those immediate reactions that take place. I don't know if you know anybody like this. I know in my senior class I had a girl that unfortunately her dad passed away from a wasp sting, and he actually had I think you snapped there. Oh, I was scratching my nose. That's really good. I think he had an epinephrine, one of those EpiPens, because he knew that he'd had problems before, but it just wasn't. He worked as a Missouri conservation agent, and he was out on a project somewhere, and he just simply did not have the epinephrine pen with him. So, you sometimes have kids. You want to make sure your children are not sensitive to peanuts, because that's kind of a big deal. I know my dad used to, when he would eat peanuts, if he had just a sliver of peanut, his throat would swell up. And that's kind of that allergic reaction. But that's not what we're talking about as far as food sensitivities. Food sensitivities, we don't get that same kaboom, very dangerous and possible anaphylactic shock type of reaction. We get the type that creates inflammation in the body and just causes people not to feel well and can cause a whole host of problems. What do all of the following conditions have in common? Has anybody seen that anywhere? Did you see that in our newsletter? We wrote that? Okay, good. I was just taking a poll to see if everybody wrote those newsletters, because we put a lot of work in those newsletters. I'm glad you read those. Headaches, digestive issues, migraines, bloating, eczema, psoriasis, fibromyalgia, gas, rheumatoid arthritis. How many would realize that if somebody has rheumatoid arthritis, even the crippling type right there, that as its fundamental basis very well can be food sensitivities? Diabetes. How many knew that blood sugar problems can be a result of food sensitivities? Absolutely so. Absolutely so. Crohn's disease, that's something that goes on in the intestines. Autism. How many knew that? The first thing you need to do, we've seen children with autism in here. One of the first things we do is identify food sensitivities in those children. There's other things we do. It's very important to get them under upper cervical care. But the food sensitivity is a prime thing that we're really going to be looking at. Irritable bowel syndrome, ADD, ADHD, trouble focusing on tasks. Nobody here has that problem, right? Okay, that's a joke line. They don't get any funnier than that. Insomnia. Some people just can't sleep. Now, I'm going to wrap this up just a little bit and just talk about it in these terms right here. That there's so many conditions out there that people are suffering from that don't really realize that food sensitivity is the problem. It's connected to 100 known medical conditions. What is this? Rheumatoid arthritis, psoriasis, eczema, irritable bowel syndrome, migraines, chronic fatigue, fibromyalgia. You could just name them off. All kinds of conditions that people can have when they have food sensitivities. And they're connected to 150 known symptoms. This slide didn't come out very well, but the foods that you like may be causing you, and it names a whole bunch of things, everything dermatitis to hives to bloating to palpitations. Palpitation, heart palpitations. You ever heard of somebody have heart palpitations? More times than not, this is a food sensitivity. When somebody has heart palpitations, it is almost always a food sensitivity. Now, sometimes it can just be the atlas is out of position, putting pressure on the brainstem, it's not regulating the heart properly, and you can get those palpitations. When somebody has palpitations, it is very important to get this under control, because palpitations can lead to things like atrial fibrillation, and these things increase your risk of strokes, so it's very important that the ticker is ticking right like it's supposed to. Sensitivity patterns in children. Tension, fatigue, recurrent otitis. When we have a child that comes in here, and we've had a number of children, we see a lot of babies in here. If you're a patient here, you know we're sometimes stumbling over babies when we're checking people. When babies come in here and they, let's say they've been on 3 or 4 rounds of antibiotics, or my goodness, I had a lady a few years ago come in here, her child was 2 years old and they've been under 30 rounds of antibiotics.
Oh my goodness.
You know what it was? Just needed to get the child adjusted, took them off milk, no more problem. And I've got lots of examples, but that was probably 6, 7 years ago, has not had an incident since. And after that period of time, he was 2 years having otitis media all the time. And so, I don't like to make this statement because I make this statement, it almost sounds like it kind of hurts my credibility in other statements because it almost sounds unbelievable. But we just don't see children we can't get straight now. I mean, maybe we've had it happen. But if you find the food sensitivity, get their head on straight, do those things right. Your parents are saying, you're right about that. I'm talking about the little ones. But if you'll do these simple procedures, you will find that the main of these children will just do fantastically well, and you can stop the whole process of doing the tubes and the ears and the rounds of antibiotics. And I'm going to describe here in a little bit what the rounds of antibiotics are doing to the children. This is just a picture showing when people have food sensitivities, it can cause basically pain anywhere. It can cause, you got a picture of the brain up there with the dot? I mean, it can actually cause people to have emotional problems, can cause people to have depression, can cause people to have just psychological deals going on, or just not a sense of well-being, or it also can cause back pain, hip pain, knee pain. There's just a lot of things that can create from this. Okay, food sensitivities. Now, here I'm getting into really where it comes from. We talk about food sensitivities, but you always want to know what's behind the curtain. Like, not the Wizard of Oz, but I'm trying to think of a better example of the Wizard of Oz. You want to see what's behind the curtain. What is it that's producing all these food sensitivities? And I will tell you, it's all about the digestion. And that is what the bulk of the rest of this talk is going to be about. We're going to talk about digestion and talk about how to improve digestion and talk about things that you can do on your own that's going to help you walk through this process. Digestion actually starts in the mouth. Now, I don't know if you see people, my dog does this. I used to, like if I had a nice cut of meat or something, I love my dog, it's actually, I inherited my dog from Dr. Chris when we got married and so, but anyway, I'm a good stepdad. I enjoy the time. We have a great time. So, but anyway, one time I was eating this really nice piece of meat. I don't remember what it was, but it was some kind of steak. And I had a little corner left like there. And, Sammy was just sitting there looking at me. So I was like, okay, here we go. So I gave it to him. It was only about a $4 bite of whatever it was. But anyway, he took it just like that, and there was no chewing. It just went like that. I was like, you are never getting food like that from me again. You didn't even enjoy that. I mean, it'd be okay if you savored it and looked up at me and winked at me and thought, thanks, Dad, that was great. But it was none of that. You wolfed it right down. But here's the deal, is that digestion begins in the mouth. It's very important that we chew. It's very important that we chew enough to get the food mashed down in an appropriate manner. The reason why is because that food is going to go from here right into the stomach. And when it gets down into the stomach, we have a process. Here's the esophagus, and it's going to come through this esophageal sphincter, and then it's going to get in this zone right here. Now, this stomach is filled with acid, hydrochloric acid that is so caustic that if you held out your hands and actually poured it in your hands, it would melt your hands. The inside lining of the stomach is specially designed to be able to handle that kind of acid. Even then, the inside lining of the stomach only lasts about 5 minutes and it's replacing itself. Your stomach lining is replacing itself about every 5 minutes in the usual circumstance. Yeah, tissue cells. You're making like 8 billion tissue cells a minute. Your body's, tissue cells die and then they replace, die and replace. That's a process of life that happens. But inside the stomach, they're rapidly changing because of this caustic environment. But let me explain something. It's very important for it to have that caustic environment because that's how the food gets melted down into its smallest particles. That way, it can be released and go in the small intestine and be absorbed and assimilated and all the things that needs to happen. Does that make sense? Do you ever hear anybody say, oh, I got a lot of acid. I have a hiatal hernia. I've got GERD. I've got whatever. Do you ever wonder what causes that, how that comes? Acid reflux. There's a lot of, there's a lot of words for it. Let me show you something here. This is, okay, so this is the esophagus. This is the esophageal sphincter. Sphincter is just a fancy word for a doorway. This is what opens or this is what closes, okay? So the acid comes down into the stomach just like this. The acid is up here in the stomach just like this. And that acid is very caustic, as we're talking about here. But there's a little sphincter down here. You see, this is called the pyloric sphincter. It's not important to know those names. I just want you to understand the concept I'm talking about. That's pyloric sphincter is like the gatekeeper. Now watch this. This is very, very, very important. When the food contents come right here, when the food contents are right here, just like that, when the food's almost finished and ready to go to the small intestine, I got to tell you, God is good. To work out how this body works is just phenomenal. I mean, I would have never created something like this. Neither would you or I. I mean, anybody. I mean, this is just phenomenal. Watch this. A little bit of this food content will go into the small bowel, into the small intestine. A little bit. Now, that little bit will communicate with the cells right here, and it will test it to see if it wants it or not. If it does not want it, it sends a message up to the brainstem. The brainstem sends a message down here, says, shut it off, we don't want it, or at least bring it as slow at a time. When that happens, boom, it comes up this way. That's where acid reflux. When people have acid reflux, GERD, they have all these conditions, it's not because they have too much acid. Usually they have too little acid, and the body's not digesting the food properly. So therefore, when it goes down there and you're getting the test, the body's failing the test, and it's rushing it back up through the esophagus. And of course it's going to burn the esophagus, because any acid at all is going to burn the esophagus. Does this make sense? This is a very important principle. First, you start with chewing your food good, because if you don't chew your food good and it's laying in here, it doesn't dissolve it good. Does that make sense? So it gets here, you got to allow it to dissolve really good, and then let that gatekeeper say, come on through.
Come on down.
Come on down. You bet. You bet. All right. Your dinner amounts to 20% protein, 35% carbohydrate, 25% fat, and if you keep on bickering, 40% stomach acid. So, now, let me take this moment just to describe this. There's two divisions of the nervous system, two main divisions. There's one called the sympathetic, one called the parasympathetic. Here again, don't get hung up on that, but what it means is this. One side is like your fight or flight. It's the thing that maintains stress levels and your fight against the environment, whatever. But there's another side called the parasympathetic that relaxes you. It's the one that puts the brakes on everything. It's the one that heals your body. It's the one that takes care of you in that manner. Now, you need both of them. Like, if you're walking through the woods and a bear chases you, it's not really good to have that one side that wants you just to relax. Although I've heard that if you just lay down, it's okay. But I'm not going on that theory. But I'm not suggesting you do. I'm always just going on the theory I'm going to be faster than the person with me. But that's my theory. So just kidding. So, that is terrible, wasn't it? I didn't even think it was that funny when I thought it in my brain before I said it. But anyway, so the parasympathetic side is the part that relaxes you. Now watch this. Digestion is controlled. Digestion is actually controlled, this process, from the relaxing side of your nervous system. That's the reason why it's not really good just to eat and go. Oh, well, cram it and go down the road. Or you're driving down the road and you're just, stuffing the donuts and the coffee and all that in. Seriously. Now, I've been to Europe on a number of occasions, and one of the things that they do that I could be a little hyperactive. I'm going to admit to that, but they can have a 3-hour dinner. I mean, they're not joking around. Like, it's like you do. Like, I'm full after the third course, and like there's 12 of them coming. So it's bad. But anyway, the interesting thing about it is maybe that's just they did it because we were guests. But they take. What I experienced is they were taking more time to eat. Sitting down with the family, eating, having that nice, relaxed time. And I know it's not always, possible to do that. I mean, I live in a crazy household just like everybody else does. But, it really is important to be able to, when you eat, to be relaxed. It really is. Because what you're doing is you're promoting that relaxing side of the nervous system, which allows and assists this digestion. Like, I'm so wound up right now, I should not eat anything. I got to relax and then allow the digestion to take place. Okay? Does that make sense? Okay. All right. Okay, we're doing pretty good actually on time so far. That's good. This is a picture of it's a drawing of the small intestines. Now, what are food sensitivities? Here's what happens. Food comes in here that's only partially digested because it didn't get in the stomach acid right. It gets in here and it starts looking like a foreign protein to your immune system. It starts looking foreign, so you have white blood cells that will begin to attack it. if it's not properly digested. Does that make sense? Now, there are some foods that have, or some proteins in foods, like particularly milk, gluten, corn. These are all things, yeast, these are all things that are common for people to have problems with when these proteins are seen in here and they're not digested properly. So that begins the process. So the food comes into here, and it's not all the way digested. And because it's not all the way digested, the white blood cells go overboard and start attacking it. And that sets up a series of events. The next thing that happens is when those white blood cells combine with what they call the antigen, or that foreign protein, when it combines like this, then another white blood cell grabs it, takes it into the bloodstream, and that is where we start getting all the other stuff, the rheumatoid arthritis, not feeling good, the fibromyalgia, all these other things that are going on, because you've got things in your bloodstream that's not supposed to be there, and your immune system is going to do what it's supposed to do. That's going to seek and kill and destroy something that's not supposed to be there. Does that make sense? Okay, so let's move forward right here. Now, this right here is what's called the epithelium, but this is the inside lining of the small intestine. If you notice, it kind of looks like fingers right there, and so there's all kinds of stuff happening in here that's important to the process. You know, there's bacteria in there that's supposed to be there. There's about 500 different strands of bacteria, different types of bacteria that are in your gut. Did you know that? About 70% of your immune system is actually in your gut. Not only that, but now they're beginning to say that your gut is your second brain. Have you ever heard that?
I've heard that.
You've heard that? Exactly. So let me just break. Let me pull away from what I'm talking about and then get back into it. There's a concept I want to get across, and that is the brainstem, which sits right in between where your head sits in the spine. That area, it's about that big right there, about the size of a 2-year-old baby's fist. That is the seat of control of what's called the autonomic nerve system. The autonomic nerve system that's that sympathetic parasympathetic. That's that part that speeds you up and slows you down. That's largely what allows us to stay alive in this environment. Like, our ability to be healthy and well, it really depends on our ability to adapt to the environment, whether it's from a food we eat, whether it's from being outside, or whatever it is. If we can adapt to the environment good, we can be healthy and well. The autonomic nerve system is really the center of control of that. Now, the reason why I bring this up is because in your gut is another thing that controls the autonomic nerve system. So both the brainstem and the gut are controlling the autonomic nerve system. Now, let me back up one more, and I'm not going to get any more in-depth than this because we don't really need to. The autonomic nerve system is in control of the 3 main systems that allow you to have health in your body. There are 3 main governing systems in your body that allow you to be healthy and well. If you get these 3 systems right, you will be healthy and well. Number 1, your immune system. Number 2, your endocrine or hormone system. And number 3, your nervous system. All 3 of those, if they're working right and they're in balance, you will have health. And you will be largely pain-free, not on a chronic basis. Or you won't have chronic pain and all these other things that go with that. So just think about it in this thing. Autonomic nerve system, which is controlled by the brainstem and the gut, are the main controllers of those 3 main systems. Does that make sense? That is why when we do something that offends this, it kicks off the autonomic nerve system. When you kick that autonomic nerve system, that's the reason why it's making a food sensitivity, and all of a sudden it's causing emotional problems, depression, or it's causing immune system problems. They're not healing properly, or the child's always having otitis media, or it's causing nervous system problems or other problems that go with that. Does that make sense? Okay. Don't get all sad because I'm going to tell you what to do about it a little bit. Everybody's like, "Oh my goodness, I'm dying." No, that's not what I'm saying. What I'm saying is I want to teach this, and then we're going to go through this for a better understanding. Okay, so just as a recap, the acid is in here. It's supposed to be in there. You know, if you don't have acid in your stomach, you cannot absorb calcium. If you don't have acid in your stomach, you can't absorb protein. How many know that those are very important things to absorb? Mm-hmm. Now, today, what's the big thing that people do when they have acid indigestion? What do? First they start with Tums or Rolaids, then they go to what? The purple pill and the this and that and the proton pump inhibitors. Well, what the protein pump inhibitors are doing is they're decreasing the amount of acid in here. Do you think that's making the situation better or worse? it's making it worse. Because remember, the reason why this is happening is because there's too little acid in the stomach. The food's not getting digested well, so when it hits here, it's sending off a signal because it's hooked up to the autonomic nervous system to tell that, hey, we don't want that, and it starts pushing it up that way. But it's not because there's too much acid in there. It's because there's not enough digestion going on there. Does that make sense? So heartburn is not from too much acid. It's from not enough digestion taking place. All right? Good. I think that's a really good point. I mean, because, this is so, if you think about it, okay, I was back over here. I'm not back on my subject yet, but I got to say one more thing if you'll allow me the room. If you think about it, most medications are taken and they're a short-term fix for a long-term problem. Short-term fix for a long-term problem. In other words, if you take a Rolade or something, you say, oh, I took that Rolade and I don't feel the acid anymore. Well, guess what? You're not absorbing the calcium or the protein or you're getting anything out of your food either. And not only that, but over the long period of time, you're making the situation worse. If you think about it, when the people take the bisphosphonates, those are the ones, those osteoporosis drugs. Now they're finding, I just saw a commercial a month ago or so, I think I was telling some folks about this last time, that there's lawsuits going on because these osteoporosis drugs are actually putting more content in the bone, but they're making the bones weaker.
Mm-hmm. I've heard that.
Have you heard that?
I've heard that.
Now, here's another case. It's a short-term fix for a long-term problem. Long-term prospect is life. High blood pressure pills. You take high blood pressure pills. And I'm not telling anybody stop taking your medicines. I'm just explaining the principle here. That if you're taking high blood pressure pills, if it were something for long-term, you just take one. You would never have to take another one, Walter. But you got to take one today, and what you got to do tomorrow? Take another one. Why? Because it's a short-term fix for a long-term problem. And what they're finding is hypertensive drugs are not reducing what's called the CAS, which is the central aortic stenosis pressure, or the CAP. The pressure that comes right out of the heart, that's the one that counts, out of the aorta. But they're finding that the hypertensive drugs actually reduce your blood pressure in your periphery arteries, but it's not reducing in the main part, which is right on top where the aorta. It's called the CAP. There's a study called the CAFE study, C-A-F-E, CAFE study. You can Google it up and they'll explain all that for you. It's a big landmark study. You might not have heard a lot about it.
I have heard.
Yeah, we're not talking a lot about it. We don't want to starve the apple cart. Okay, good. So here's the inside lining, and here's the protein, and I just had that on there because it's a colorful picture. How's that? Okay, this is a healthy lining for your intestines. Okay. Now, what happens when we get the foreign molecules in there? It's called foreign because it's undigested food. So let me just say it that way. What happens when we get too much undigested food in the small intestine? It creates that inflammatory response because why? The white blood cells are doing what they're called to do. They start going after things that are not supposed to live there. Okay, you got that? Now, when all that inflammation starts taking place, it starts tearing this up. And so instead of having nice little fingers out here where the food kind of assimilates and absorbs, now we have this situation, and you start creating even what's called a leaky gut. Which means that there starts to become separation like this, separation between these cells, and now these foreign bodies, instead of just being in here undigested food, that undigested food starts going straight into the bloodstream. And whammo, that's when you get the food sensitivities. When this undigested food or wrong particles go into the bloodstream, and then it's in the bloodstream that we begin having this cascade of events. Now everybody's individual. So one person it could result in scleroderma. Another person it could result in migraine headaches. Another person it could just be chronic pain. Another person it could be chronic fatigue. Another person it could be thyroid problems. A lot of times people have a thyroid problem. I'll just make the blanket statement. Sometimes people do have thyroid problems, but most usually when somebody has a thyroid problem, it's coming from something else. The thyroid gland is usually working fine. It's just something else is not working that's not allowing it to function. Food sensitivities is a big cause of thyroid problems. So there you go. You guys learn anything from this?
Yeah.
It's pretty good, isn't it?
Real good.
Okay, so here's the next thing. I'm going to start talking about the stuff that we need to do to make our guts healthy. How many wants a healthy gut? I know. It's not a pretty subject, but we got to take care of this. If we take care of this, it will increase our health. There's no question about it. Okay, so we have an immune reaction, histamine release. This is that white blood cell. I didn't like that thing that comes through the small intestine, wasn't digested properly, not enough acid in the stomach, it pushed on through, so I attacked it, right? That's what the white blood cell did. Then, that caused pain because of what went into your bloodstream. We take an anti-inflammatory, an NSAID, for the pain. Because what a lot of people do when they have chronic pain, they take medication, right? The medication actually damages the gut further. And then the cycle continues on. That's the reason why. Fibromyalgia. Now they said this, I think about 3 or 4 years ago. I don't know what the new stance is, but I actually read this, and this was like their official guide. They said if you have fibromyalgia and you follow the treatment that is prescribed today, traditionally prescribed, you can expect in 5 years for the pain to be more widespread and to be more intense. Well, this is why. Because the problem started as a gut problem. I know when somebody has knee pain that's chronic, they don't really think that it's the gut. But it really can be. But if it is the gut and you don't solve that, you can do whatever you want to the knees and it's not going to correct. Does that make sense? I mean, you have to find the problem first and then fix the problem. So, good. All right, I'm not running for office, so.
We vote for you.
Okay. All right. All right. So here we go. I don't even want to look at that. Let's don't look at that. Good. I think we got the point, right? We got the point? Okay. All right. What causes damage to the intestinal lining? These are things that cause medications, NSAIDs, non-steroidal anti-inflammatories, antibiotics. You know, here's what we do. We take antibiotics like they're candy. We really do. And I'm not getting on to anybody, but, oh, you got a sinus infection, take an antibiotic. Oh, you got a fever, take an antibiotic. Oh, you got this, take an antibiotic. We don't realize what that's doing to the gut. Because, see, one of the things that the gut has to be healthy is it has to have an ample supply of its probiotics in there. It has to have an ample supply of its right mixture, if you will, or balance is a better word, of bacteria in there. You know, we have good bacteria, bad bacteria, but they keep themselves in balance. Does that make sense? So when we take antibiotics, it's not just selective to kill like that bug that's in the ears. It wipes things out in the gut and it causes problems. Alcohol. Ethanol has a damaging effect on the lining of the small intestine. Viral, fungal, and bacterial infections. This is a big one. Parasites, another big one. You can get a hold of a parasite and tear up the gut. Tear up the gut, and all of a sudden you start having thyroid issues, these issues, other issues. And if we don't solve the problem, let me just say a plug right here. When somebody has thyroid problems, and we see people with thyroid problems in here, when somebody has thyroid problems, we always back up and say, what's driving this? What's causing this to happen? Because we have to solve what's happening. I'm interested in the person feeling well. I'm interested in them being healthy and well, but I'm more interested in what's causing that thyroid to act funny. Because if we can figure that out, we can resolve the issue. Okay, refined sugars, refined foods, sugar, high fructose corn syrup is horrible. You know what that is, high fructose corn syrup? The marketplace is really driving a change in this, and that's wonderful because, used to, that's what was in everything. And without people knowing they were having a dysbiosis, that's when you get an imbalance in your bacteria in your gut. Stress chemicals, high levels of cortisol, you get all stressed out, it causes your body to manufacture chemicals that are actually damaging to the inside lining. Cumulative toxins, burdens for heavy metals. I think we talked about this last time. Walter, you were here, I believe. We're talking about right now, we have 400 times more lead in our bones on autopsies they did 100 years ago. So in other words, if they do an autopsy on a person right now, on average, that person has 400 times as much lead as they did 100 years ago. 400 times. So we have a lot of those burdens. But here's, it's not doom and gloom. There's things that we can do about this. Food additives, plastics. Plastics is a big deal. There's something called BPA. Bisphenol. Does anybody know the name of that? Bisphenol, is that right?
Yeah, I know what BPA is.
I believe that's what it is. But BPA, if you see BPA, stay away from it. A lot of your plastic, especially your cheap plastic from water bottles, just regular water bottles that are plastic, a lot of them have BPA in them. Some of the higher end ones don't. They have the BPA, but look and see. Because when you're drinking that, you're getting the BPA, the plastics in there. Just as a side note right here, that can mess up the inside lining of the artery, that was last month's talk, the arteries, the gut.
Yeah.
But watch this. The thyroid. Let me back up just a minute from what I'm talking about. I'm talking a lot about thyroid tonight. There must be somebody who has a thyroid problem. I don't know. But anyway, the thyroid secretes something called T4 and T3. And those are the thyroid hormones. Every cell in your body, like this, let's say there's trillions of them, but let's say your cell looks like this. Every one of them have little receptors that come out of the top of them, just like that. And this receptor will recognize a thyroid hormone when it's coming by. And then when it recognizes the thyroid hormone grabs onto it, and then it pulls it right into the cell, and that's how the cell gets energy for its work. Does that make sense? So there's little receptors. It's almost like an antenna on top of your house. It's a receptor to bring it in, right? When we have too much BPA, too much plastic, it actually mutes these receptors, and then your cells don't recognize the thyroid hormone, so you don't have a thyroid problem, but you have all the symptoms of thyroid problem because your cells are not getting the benefit of the thyroid hormone. So anyway, that's just another side note. It actually will tear up the inside lining of the gut. Emotional trauma, surgery, and head and neck misalignment we're going to discuss. Why does it seem food sensitivities are increasing? You ever wonder why that is? You hear a lot more about this. Increased chemicals in the air we breathe, the water we drink, and the food we eat. Genetically altered foods, GMOs, this is a big one. I'm really not in favor of GMOs. I'm really, and you know, it's really unfortunate, but we really, I personally think that we need to do something as a culture, as a group of people, and just say, you know what, we're not going to do that. We can't do that. You know, so it can cause a lot of problems for people. Malnutrition, unhealthy lifestyles. Of course, we know about that. No regular exercise. I think my mom actually made that slide, so she must have liked the toxic people that I have. But anyway, nutritional deficiencies, food and food preservatives, chemicals, bioengineered foods, petroleum-based fertilizers. Okay, I kind of zipped through there, and just wanted to pick one thing out of this slide, and that's 105,000 toxic chemicals in the EPA's inventory, and 1,500 are added annually. In other words, they allow for that many to go out in the atmosphere, and so, you know, and so many, you know, every year they allow so many more. And I'm not trying to make everybody afraid to go outside. I'm just saying that, you know, these things are out there, so we've got to do everything we can do to make sure that our bodies are strong, because all these things can cause a problem. I'll have the half-pound double deluxe bacon steer burger, please. You want chemotherapy with that. So, there you have it. Okay, immune system must differentiate between proteins. Okay, so what this means is just what we've been talking about. When food comes down in the gut, there's white blood cells down there that have to determine, is this a good guy, is this a bad guy, what is it? Then when they determine it's a bad guy because it was not completely digested food, or here's what happens, over a period of time, years of abuse of that, then even if that milk protein is absorbed, it's going to go after it because it doesn't like that milk protein. So then, once it gets into the blood, it starts looking for things that look like that milk protein. It just happens to be that the cartilage in your knee, the protein that makes up the cartilage in your knee is very similar to the protein that makes up milk. So a lot of times people have knee pain as a result of milk sensitivities. There's other issues out there, of course. I'm not just beating up on the milk. Autoimmune disorders, let's just move on because I think this is important. The link between the brainstem and the gut. Now this right here is the brainstem right here, and down here is the intestines. Now, just like I was showing you with that stomach in there, when the food starts going in there, if it doesn't like it, it sends a message right to the brainstem. Brainstem sends a message down here, and that whole process is taking place. There's another issue that I didn't talk about as much. The acid breaks down the food. Then it gets into the small intestine. Then you need to have an ample supply of digestive enzymes, primarily from the pancreas, that go into there to help break down the food further. Guess what happens if you don't have enough digestive enzymes? It still doesn't break down, and we still have that same process going on. The liver releases bile and the other products right into the bowel. If the liver's not working good, guess what? Your food's not digested well. That's another thing that sets you up for food sensitivities. Are you guys getting the picture? I mean, you see how all these things are happening?
Coming good.
Yeah, it's so anyway, but we have to do something about it. Now this is just one more picture. This is the inside lining of the gut. I just wanted to show you all the nerves and all this. These are what this is what's communicating right to the brainstem to let it know what's going on. So this isn't something that's just happened by itself. All the time when you're doing digestion, there's a complete thing going on here. And remember this: the gut and the brainstem control the autonomic nerve system. The autonomic nerve system is in control of the three main systems, which is, I teach doctors and I say, which is, and I'll wait until they say it, but I'm going to be easy on you, Gilbert. Which is the immune system, the hormone system, and the nervous system. If you think about it, when people have problems, it's usually in one of those systems, isn't it? Their body's not strong enough, they're always having, challenges with the immune system, or they're having hormonal difficulties, or they're having nervous system problems. Okay. Here's a picture of the brainstem. Right here's where the brainstem is, and this is largely where the place is that controls the area of the gut. And right here is where your head sits right in the cradle, and that's the first vertebra. That's the reason why when your head comes off position, it can actually, it's very, I like this picture. This is a little off the top, but I want to show you something while we're here. You see this guy right here? You know what that is? That's the vertebral artery. That's the artery that supplies the base of the brain with blood. What we're finding is that, hey, Rex, what we're finding is when the head comes off balance here, it can interfere with the blood flow in this brainstem. Now, to get a little more technical about it, how many's heard of cerebral spinal fluid? Cerebral spinal fluid, ever heard of that?
Yeah.
That's the stuff that floats around the brain, goes the spinal cord up and down, cerebral spinal fluid. That's what gives nutrition to the brain, spinal cord, and so on and so forth. What we're finding is when the head comes off position, we're finding this through MRI studies. When the head comes off position, it's actually putting a kink in there, and it's blocking the cerebral spinal fluid flow, and this is what's causing the aberration or the problems in the blood flow right there. So, get down to the bottom line. You cause a blood flow problem in the brainstem, you're causing an autonomic dysfunction. Does that make sense? So that's the reason why when somebody comes into us and they have something going on with the hormones or something going on with the immune system or something going on with the nervous system, we always check this first because this is the seat of control. But guess what? So is the gut. So primarily, I tease with Kimberly here. She helps us do food sensitivity. She helps us a lot of things with dealing with patients and so forth. But I tease people like this and say this. If we can get the head on straight and get the gut cleaned up, 95% of people's problems will be taken care of. You got to get those two areas fixed as a basis. You might have some specialty things that you need to do, but far and large, if you get those two issues, you'll go a long ways. Think about this: gravity is the number one stress on the human frame. It's always pulling us to the center of the earth, and so when the head comes off position, it causes that kink in here, blood supply, autonomic nervous system. Traumas years ago can cause problems today. Birth trauma, car accidents, slips, falls, bumps, all these different things can knock the head off position that can cause that problem to happen. And here again, going back to the gut, if this isn't working right, it causes this not to work right, and if this isn't working right, it causes this not to work right. A very interesting thing that I found, I've been doing what's called upper cervical chiropractic work for a number of years. I've been doing it over 20 years. And I've been running graphs. As a matter of fact, you see that right there? You see that little callus right there? That's a callus that I get from running that graph right there. I've had that there for years. It just grows big like that, and I have to cut it down, because, I run that graph. I run that graph, several hundred times a week. So I understand what that graph's telling me. And I'm not trying to, lift myself up above where I should be, but I'm just saying I know what that graph's telling me when I'm seeing it. I've seen it over 20 years. I know what it's saying when I look at it. And a very interesting concept that I find that somebody has a food sensitivity. If somebody has a food sensitivity that we have not identified, we run those readings, they will not get us straight, and they will not clear out as well. And the reason why is because this is not the only issue in getting this straightened out. You also have to straighten the gut out. Does that make sense? My dad told me that a long time ago. Of course, being the smart guy I was, I didn't believe him. But I found out that's true. I had a patient come to me, and a great gentleman. He was 78, 80 years old. Wonderful man, wonderful man. He came to me, and I'd been seeing him for 4 or 5 years, something like that. And he started having a lot of problems. He had congestive heart failure. I could see, I did an examination on him. I said, this guy's having congestive heart failure. He's beginning to almost drown in breathing. His ankles were real swollen up. He had other swollen up areas in other places of the body. He had all the characteristics of congestive heart failure. So I didn't know what to do with him as far as, because he didn't want to go to the hospital. He didn't want to just go get checked out. So I said, you know what, you need to go see my dad. I know he lives in Rolla. It's a 3-hour drive. I understand it's an investment to make that kind of drive, but you really need to go see him and just see what he says. So the guy didn't have a lot of money. He was, just didn't have a lot of extra money. And so anyway, he goes and my dad talks to him for 30 minutes, 45 minutes. And he told the guy, he said, now we can do this. We can run a blood test on you, and we can do this test, we can do this test, we can do this, we can do this, we can do all these things if you want to, and it's liable to be $1,500, $1,000. Now, or you can just stop drinking milk. Which one would you like to do? So he quit drinking the milk, and in 3 days that guy was well. Now I could have kicked myself because I should have known that, but I was very glad to have my dad there to help me walk through that process, because that happened about 10 years ago, and that's what began opening my eyes to this and realizing how important. But you know what else happened? I realized, this is a good one for you back there, Jim, I realized that I adjusted him. I was adjusting him every other week. Skin adjustments every other week. Now, we did that, and he quit drinking the milk. And with him, it doesn't happen with everybody. Most people have more problems than that. But with him, he quit drinking the milk, and he would hold the adjustments for 3 to 6 months after that. He needed less adjustments. Why is that? Because upper cervical is not just upper cervical, it's what's going on in the whole system. Fix the gut, fix the brainstem. Fix the gut, fix the brainstem. Does that make sense? So this is a very important issue. Very important issue. Okay, and like I said, we can run readings, we can know when there's interference. By the way, it's very interesting that they've done a study and they found that this guy wrote a paper. He said he reviewed over 6,000 papers. I don't know it all. I've not done anything 6,000 times that I've maybe driven back and forth here over the last 20 years 6,000 times. But I can't think of anything I've done 6,000 times. But anyway, he says he read 6,000 papers. He said after reviewing 6,000 papers on what's called thermography, which is this type of readings that we do, he said that if a person is in the green right here, that's normal. If a person is in the yellow and they stay in the yellow, in other words, all these were green, but just one yellow, and it stayed yellow all the time. Like you check them this week, next week, the next week, the next week, and it's always chronically showing that heat differences. That person, 18% of the time, 18% of those people were growing some type of active disease, some type of process. If they were in the orange and they stayed in the orange day in and day out, that person, 54% of those people are growing some kind of active disease. Diabetes, cancer, heart disease, something that's going on, something that's going awry. If you were in the red, that percentage went up to 92%. So the farther your heat readings are off, we know that it actually is related to disease. But here's the interesting thing. I told my dad a couple of years ago. We went to the gym, and I think we were lifting weights together. Anyway, we went to the locker room. We were just sitting there talking. He was telling me, he said, I had this girl come in, and I think she's 8 years old. And she had all kinds of stomach problems, but she was also having, I think, behavioral issues. She's having other things going on. And Dad said that I did the food sensitivities. They followed it really well, and she had no more problems after that. And I kidded him about this, and I said, wow, you're a great upper cervical doctor. Now, I was kidding him about that. Of course, he didn't do the upper cervical work, but I would be willing to bet, although I'm not really that much of a betting person. I find it doesn't do well for me. But anyway, I would be willing to bet if I would run a graph on this little girl before she got on the food sensitivities and after, we'd have found a better looking graph. Because there would have been less tension on the nerve system, the body would have been functioning better. Remember, brainstem, gut, brainstem, gut. Okay, good. All right, we were doing good on time until I told the stories, but sorry. We'll try to catch it up. Head is tilted to the right, and the atlas first vertebra to the which is the cradle, has misaligned to the right. It just shows you. I mean, this is just a usual picture. This is interesting. Right here is where the skull is. You see that right there? And here's the second vertebra. Here's the first vertebra right here. Now I'm showing you this because right where that arrow is, that's pretty much where the arrow. That's the area that controls that gut. So see the first vertebra. So can you imagine if you had your head off position that it could actually do something to that? You better believe it can. Better believe it can. Okay, that's just about the nerve system. Okay, stop fixing. Healthcare system, see it futility. Boy, isn't that true? Isn't that true? I mean, my goodness. Start preventing. We've got to start taking it. And you know what? It's everybody's responsibility. We have to take care of ourselves. If we don't take care of ourselves, it's not going to happen. You know, even when I'm talking to you and I'm, giving you suggestions, do this, do that, you have to evaluate and do, you have to take the steps to really make it happen. I can't necessarily, I guess I could, but maybe have dogs that bite me, but I can't just go to your house and start checking you and giving you recipes. You know what I mean? You have to do something. I have to do something. I have to make sure I'm taking care of my health. You better believe it. Strategies to overcome the ill effects of food sensitivities. Okay, let me just say one blanket statement about that. We've got to heal the gut. We have got to heal the gut. If you want to get to the food sensitivities, heal the gut. That is the big issue. So if you have a test at the end of this, and somebody says, what did he say in that whole 3 hours he's talking? He said, heal the gut. He said 3 words. That's all he said. Okay, first identify the food sensitivities through IgG, ELISA food testing. Now, let me just caution you about this. because I've had patients that come in and they say, doc, yeah, I'm not, you're not in my plan, and I've got insurance and I would like to get that done, but can I just do it through the insurance? And what I usually tell them is I would love for that to happen. But the problem with it is the IgG laboratories are specialty laboratories. And because I've done this. As a matter of fact, I just gave in 3 months ago on somebody said, okay, well, I'll write you a script. You take it to your medical doctor, and then they can get it done. I said, I'm fine doing that. I don't really care to do that. It's fine. It's not, I just want you to get the test done. You get the test done, you'll do better. And I just did this 3 months ago, and they came back and they ran the IgE, not the IgG. Remember, the IgE is about the food allergies, because in the medical mindset, I'm not criticizing, but in the medical mindset, we're thinking about danger, we're thinking about emergency, we're thinking about allergy. This is not allergy, this is a sensitivity, which is not dangerous, it just causes people to be sick. Does that make sense? So really the situation is there has to be a very specialty lab that does this, and unfortunately they're not generally hooked up in the insurance, so that's just the way that goes. Stool culture study. We do stool cultures on people, but actually we have to send them home to do that, but we don't. We send it off to a lab, and we do this for the people that we suspect have parasites or something really weird going on in the gut, and sometimes that happens. But here's the way I do it. The first thing I do is I get the food sensitivities, identify them, get the person away from those foods for 12 weeks, long enough for the gut to begin to heal. Then we can begin introducing these foods again and start paying attention to the things we're already talking about here. Make sure you're chewing, make sure your acid's good, make sure your digestion, make sure your enzymes are right, and all those things. Does that make sense? Now, if we do that and we still have a problem, we still not resolved it, guess what? We've got to go to the stool culture because there's something in there we're missing. There's a parasite we've got to get rid of, which are very hard. There's a H. pylori we're messing with. There's something going on that's causing us not to get to where we need to be. Does that make sense? But the stool culture, I'm not sure how much I should know, but the stool cultures are about $400. And the food sensitivity is $365. So, you 400, 365, and, it starts adding up. So we try to do that reasonably. So I would start off with the food sensitivity and then move in that direction. HCl is very important. If you don't have enough HCl in your stomach, if you're having digestive issues, then we need to get you some HCl and take that while you're eating. Digestive enzymes, also probiotics, is also a good idea in the world we live in. With all the meat, a lot of the meat that we have has antibiotics in it. The beef. You know what I'm talking about, right? Mm-hmm. The beef cattle, those things, they have hormones, they have antibiotics. These things put us in position. We really need to be taking probiotics on a daily basis. I take probiotics on a daily basis. Big believer. Avoidance of the known offenders. These are some of the things that we were talking about earlier. The known offenders are the things like, I didn't mention this, microwaves. Throw them out of your house, unless you just want to x-ray people. But microwaves, what they do is they denature the food in such a way that when it gets into the gut doesn't recognize it, and guess what? That whole thing happens that we've been talking about. Microwaves are a problem. We have a convection oven in our kitchen. It takes a little bit longer than a microwave, but it heats things up pretty good, and so it's fairly handy. It's a little more handy than actually putting things into the oven. I'm acting like I know what I'm doing putting in the oven. I don't really like cooking, but I've seen it done before. So I don't mean to be a smart aleck. But anyway, the convection ovens are good, but it's worth the time. It is worth the time. It really is. Okay, and upper cervical chiropractic care. These are the strategies that we need to follow. I'm going to tell you a little bit about this food sensitivity. You guys can't probably read this. This is a food sensitivity panel that we do. This is 96 foods. These are 96 foods. I just had a doctor come to me. He's a good friend of mine. Came to me 3 or 4 weeks ago. He said, Doc, I'm not feeling well. The guy's like 47, 46 years old, something like that. I'm not feeling well. I don't have the same zest as I used to have. I'm worn out. I don't have the same drive as I used to have. I got all these things not working right. He said, will you take a look? And he's from North Carolina, is one of my best friends. And I said, sure, let's go ahead and just sit. He said, I'm ready to come to your clinic and I'll just stay there for your week. The guy's got this major clinic going on, doctors going everywhere. I said, no, you can't. Just go get the blood test. We'll look at it and then we'll go from there. So anyway, got his blood test. Didn't really show much. So we got to get food sensitivities. I just got it in today, and man, did we ever hit the bingo. This is what the guy's problem is. So here's the problem with this right here, is sometimes you don't know what this is. Like this person's sensitive to mustard. How would you ever know you're sensitive to mustard? That's another problem with these types of food sensitivities. When you have an allergy, when you eat peanuts and you have an allergy, you know within 30 minutes. You have a food sensitivity, it can delay up to 7 days before you have a reaction. In other words, you could eat something today, start having a headache 3 days later, and never put it together. Now, if you eat the same food over and over, day in and day out, and guess what? We do that. If you eat a food that you're sensitive to every single day, and you keep on doing it, then you might not even just get like a headache reaction or something. You just might not just feel good, or it starts producing things like rheumatoid arthritis or diabetes or all kinds of different things that can happen. Does that make sense? Mm-hmm. So it's not. It would be great if, I don't know if we have any golfers, but if you hit a ball and you hit it way out to the right and it's not in the fairway and you hit it way out in the woods, you know immediately that was a bad shot. But when you eat that, whatever you just ate, you don't know if that was a bad shot or not for about 7 days, and then you can't pick which one it was. So I'm more than willing to walk through the process with people and try to eliminate it, but after we get past the first couple of guesses, we just can't do it. A lot of times I'll tell people, okay, quit the milk, quit the bread, see what happens. And if they respond, go with that, that's great. If they don't respond, doesn't mean that's not what it is, just means we didn't find it. Unfortunately, it's a little bit more intricate. The less doctored your foods, the less likely you'll need doctoring. And that is very true. This is actually, you say, well, I wouldn't want that. Well, I want a worm in my apple because that means that worm said that there was something enough in that apple that I'm going to try to eat it too. So if there's no worms in the apple, I get concerned. I like worms in my apples. Now, I don't sit home and look at the worms in the apples, but that was that's a figurative amount of speech right there. Okay, let's leave it at that. Okay, I want to show you this right here. I've got two things and we're going to be finished. This is actually a case that I had published. This is, the neck is supposed to look like this. We adjusted this person. I think this person had 2 or 3 adjustments over 5 weeks period of time. And this was the first one, and then we morphed it into this. And this is what it looked like at the end. Isn't that pretty cool? Pretty good change, wasn't it? Yeah. We actually published that in the paper. This, have you ever seen anybody have a lumbar disc problem? Right here. You see this right here? You recognize that? See, this is the 5th vertebra, 4th, and then we're looking at it from the side. These are discs. See that? You see the disc? Can you see them? Now you see that guy pushed out there like that? You see that? That was before upper cervical care. Before upper cervical care. And this is 3. Yeah, this is actually the 4th lumbar vertebra. 4th and 5th. That's right. And it's all the way down the back. And this is, I believe, this was 13 months after upper cervical care.
And upper cervical, you just
upper cervical. That was it. Well, because here's the deal: when the head's off position, because of what I just talked about, this autonomic nerve system controlling, what did it control? The immune system, the hormone system, the nervous system, right? So all these systems are controlled here. So when the head comes off like this, your body and your pelvis is going to turn itself to get your head at least in the best possible position. So it may be that you have a chronic misalignment down in here in your pelvis because it's making up for this. And that wear and tear there causes the disc to wear out. So you get this corrected, now your pelvis gets balanced, and then things work. Okay, never give up. I love that. That is pretty good, isn't it? That's pretty good. We have to take care of ourselves. Now watch this. Kendra, are you here?
I'm here.
Okay, I'm going to show you guys just a couple of things right here. This right here is the stool kit. And here again, if I've already talked to you previous to tonight, and we've been dealing with food sensitivities, and we're still not, me or you are not satisfied where we're at, this is what we need to look at. If you're not there, we don't even want to consider that. Here's what I do want everybody to consider. If you have any issues that you believe this might fit you, the first thing we have to do is identify the foods that's offending you, because we get rid of those foods, allow the gut to begin healing itself. Yes, please.
Can I ask you questions
Yes,
about
please.
that now? Or
Yes,
later?
let's do it.
So, are the foods good foods? Are they wrong foods? Do you know?
We're dealing with the protein within the foods. Mm-hmm. We're dealing with the molecules of the foods. So whether it's cooked or raw, it doesn't make any difference for this.
Don't think so.
Because whether you have, let's say you're sensitive to beef, if you ate it really, very rare or very well cooked, probably wouldn't make a difference as far as the food sensitivity. But I will say this: if you eat it real cooked, like the barbecue stuff, and that stuff that we all love, that's really bad for us. They say causes cancer. You know, the black stuff that gets on there. Well, that stuff right there probably doesn't digest that well, and can create this whole problem and help create it. Like once or twice, it's not going to, but if you do that every day.
Okay.
But the protein in the meat itself is going to react the similar way. Does that make sense?
Yeah.
Okay.
I've
So
read that some tests have.
Yeah, you know.
Some don't. So it
yeah,
doesn't
this is
feel like
not.
that.
We're not really testing. This is a little different out there. That's not the realm of this test. That's right. So anyway, this will give us a guide to follow about the sensitivities. Now the next thing
Can I
is.
ask? I've got like
Yes.
2 more questions.
Yes.
About that. What made you choose this company?
Do you want my dressed up answer, or you just want the straight
Like
answer?
just the story.
That's one my dad
There's a
used.
bunch of companies.
That's one my
and,
dad
like,
used.
what
Actually, this is one my dad's used, but let me explain this. I've done probably over 500 of these, and he probably did over 5,000 of them. And he said this was the best company.
Okay.
And so that's the reason I went with it, and I know that's not a great answer, but
Well, no, I mean,
but I
just
do know, but I know from the experience I have with it,
Experience
it
is
is solid. There's
accurate.
there's some self-test out there, and there's some other things out there, but I'm just telling you that this is really, this one will do the thing for you.
And you guys
This will
have
get
done a
you.
lot of.
Oh, I've done
With
over
that same
500 of them.
company.
Yes, Race.
Okay.
I'm sorry. Oh, I know you got it.
No, good. No,
And I arrived late.
no. Everybody's just loving sitting here. No, go ahead.
There's a book called Eat Right for Your Blood Type.
Yes.
Are you familiar with it?
Yes, I am. Yes, I am.
Okay, if you followed that book, would that take care of food sensitivities for your blood
Yeah.
type?
Okay. The answer to that question is yes and no. In some cases, it will. It depends on the severity of your problem.
So you do believe in that?
Oh,
book?
absolutely. I think, but I don't believe 100% that there's a 100% rule, and the reason why is because there's some crossover. But in the main, I think it's a very good book.
Really?
Yeah. No, I think it's a good book. But I don't. But if somebody has active food sensitivities already, it's probably not. Because once you start this whole leaky gut process, then all bets are off because you start reacting to a lot of things you normally wouldn't even react to. That's the problem. That's the reason why we have to clean up the gut. But if you started from the beginning and you're eating foods for your blood types, now let me back off that a little bit and say this. There's genetic testing that you can do now that's available. And I'll have to check into it, but I think it's about $500. There's a lab somewhere here in the United States that does genetic testing, and they will actually test you and show you what foods you need to have. And it's actually a step beyond just eating for your blood type. But blood type is some people do really well with that. So I'm definitely not going to down that. So yeah.
Is there a simple way to diagnose a leaky gut?
No, there's not a simple way. There's something called an endocrine, which is a urinalysis test you can do. The problem with it is, it's not this guy. I was going to show you the gut, but that's not the guy. But when you have this situation, it's happening at a microscopic level, so it's very difficult to detect. There's a company called Metametrics right here. These guys that they do stool samples that they claim that they can do that. Now my feeling about that is when somebody's displaying the food sensitivities, just act as if, because the leaky gut, let me put it this way, the leaky gut is a broad spectrum. Meaning somebody could have a horribly leaky gut or a small amount of leaky gut, and it can be causing problems. And everybody's on that scale. There's nobody that has just the perfect lining in there. So we should all be just doing things to increase the health of the lining of the small intestine.
Can that be read up on?
Sure.
The leaky gut symptoms?
Yeah. Read. Go to Google and knock stuff out. And if you find something really interesting, please pass it on because I'm learning just like everybody else. So the only advantage I've had is I've been working in it. But if patients will sometimes bring me things and I say, wow, that's really good. Thanks a lot. So that's good. Okay, so this right here, this is the Medigest, and this is an HCl. This is HCl. So you take this basically right when you eat or within 15 minutes of eating. These right here are digestive enzymes. This is the complex of all the enzymes. And you're going to take this 1 to 2 hours after you eat because that'll help everything go through. Now, this is if you're wanting to clean up the gut. This is the first step. The next step is to put the probiotic in here. The probiotic, you take 2 of these a day, take them in the morning before you eat. Now, if you do that, this will help the process. This allows your body to start digesting the food properly. This helps reculture the bacteria. Okay? And then on top of that, once you see the food sensitivities, you get rid of those. You go through those steps right there, and that will go a long ways to healing the gut. If we don't get to where we need to be after that process, then we go to the big sledgehammer. Then we go to see if there's parasites in there or something else that's causing your body not to heal. 95% of the people will do much better than this. And I will leave you with this, and I'm going to give it to Kendra. Oh, doggone, I was doing so good, too. I thought I was going to do it in 45 minutes. Sorry.
I know you're late. Can I ask you one more quick question?
Let me finish this.
Wait, okay.
Let me finish this.
Okay.
Let me just say this. That my dad taught me a lot of things. And some of the things I'm listening to more now. But that's how we grow, right? But my dad taught me a lot of things. He passed away this past October. It's very sad. But I was always, probably wasn't a week that went by that I wouldn't call him on the phone and just say, hey, Dad, I've got this going on. I've got a patient that has this. What do you think? Or I'm thinking about buying a new car. What do you think? Or whatever. I mean, Dad was always there. And, he saw patients for almost 50 years. And he did IVs, IV nutrition. We do that because he did it. A lot of things we do, I do because he did it. Just like your question there. Well, that's what he did, so we did it. I just found out a long time ago that a lot of times this stuff works. So, he set out IV nutrition and everything that he had available, any kind of nutrition, everything he had available. He said if I could do one test on somebody, and he was actually known. We have a blood test called the Kessinger panel. It's not because we named it that way. It's named like that nationally. Like if you go to certain clinics throughout the United States, there's something called the Kessinger panel. It's not named after me. It's named after my dad because of his expertise in knowing how to read blood tests. And he's taught hundreds, even thousands of doctors how to read blood tests. And so, but anyway, even after having all that knowledge of blood tests, he told me, he said if I had one thing to do on patients and I couldn't do anything else, and you didn't even tell me what the symptoms were, but you just told me they were sick. He said if I had one thing to do, it'd be food sensitivities. He said that will solve a lot of problems. And you know what? He was really right about that. So anyway, I want to answer your question, but first, just so we can flow and go, I'm going to let Kendra take it there.